Welcome back. January is Cervical Cancer Awareness Month, which is a time dedicated to raising awareness about cervical cancer, its prevention and the importance of early detection. It's a month where we come together to support those affected by this disease and to encourage everyone to take proactive steps towards their health. Joining me via Zoom today is Dr. 𝘊𝘌𝘙𝘊𝘌𝘙, and she's the head of Reproductive Health Unit, National Population and Family Development Board. Dr. 𝘊𝘌𝘙, thanks for joining us today. Let's begin with the role of the National Population and Family Development Board. How does it contribute to the reduction of cases in our country?
Hi, hello, Melissa and the viewers. Thank you again for this opportunity for our chat on Cervical Cancer Awareness Month, definitely. So, as we are well aware that cervical cancer is actually the third commonest cancer that is affecting our women in Malaysia. And we can see about 800 new cases of cervical cancer, with 41% that diagnosed with stage 3 and 4, which is actually more debilitating and high in mortality when you come at a later stage of this cancer. And this cancer is actually we're able to prevent it, because the occurrence or development of the cervical cancer, it takes about 10 years or more, which we can actually detect at earlier stage before the cancer appear, and have the early intervention. So the intervention that we can actually conduct is HPV DNA testing, which LPPKN is actively doing this screening since 2019. So under Ministry of Women, Family and Community Development, through National Population Family Development Board, we are actively implementing the cervical cancer campaign, where we are introducing HPV DNA testing screening through the women in Malaysia. And for this year alone, 2024, we able to get as much as 5.5 million from the government to facilitate about 32,000 of women in Malaysia for them to carry out this HPV DNA testing for free. So, and we know that with this HPV DNA, we're able to detect the virus, the commonest virus that causing this cancer, which is human papillomavirus. So, conducting this HPV DNA test, and detecting this human papillomavirus at earlier stage, we can get early treatment and prevent the occurrence of the cervical cancer at earlier stage.
Doctor, you mentioned that there'll be about 32,000 women who are given this test for free. How has the response been?
So far with our HPV DNA testing, the response is really good, because this HPV DNA testing, it is different from the normal conventional pap smear testing, as it is more less pain. It is painless, very easy, because it's own individual that carried out the test instead of getting assistance from the staff nurse or healthcare workers, right? And with the easier methods, the response is better with the community, and the result is also very effective and efficient, in a way that it covers protection. We can do the screening every 5 yearly instead of 2 yearly as what was being done in pap smear testing. So, under this, so within this 32,000 that we have put in so far, we're able to get more than 1,000 monthly in terms of women conducting this screening.
When has the campaign started, and will you guys continue to push this awareness program throughout the country, or is it just concentrated in the Klang Valley, or do you all visit other states as well?
Yeah, so this month, of course, is a cervical cancer month, right? So where we really push out our campaign, but this testing will be conducted the whole year round, especially in this month, where it will be organized to all 14 states in Malaysia. So there'll be 14 programs where we also introduce it under 𝘊𝘞𝘈𝘊𝘈𝘕𝘊𝘌𝘙 campaign, which is a reproductive cancer, woman reproductive cancer campaign involving breast cancer detection and also cervical cancer screening testing. And we are currently using hashtag cepat tahu, cepat tindak, because as you know, early detection, for early action in all our social media. So with the 14 programs that will be running throughout Malaysia in this month alone, where we will go all out to the community level, such as even to the orang asli area, right? The rural area, shopping complexes, and also public halls, and not forgetting our own Klinik Nur Sejahtera LPPKN clinics all over Malaysia. And also following these initiatives, the recent media announcement that has been announced by our Prime Minister regarding the program Madani Rakyat Labuan, where to ensure the residents in Labuan do not miss out on any government initiatives, services, under Ministry of Women, Family and Development as well, we are organizing a campaign, which is the Kasih KTWKM, Gempuh Saringan HPV DNA 2024, in conjunction of this month, Cervical Cancer Awareness Month, which will take place this Saturday, 20th of January. So we do hope that the Labuan community will join us and take this opportunity with all the free services that we provided on the day of 20th of January to have especially this free HPV testing done.
Wonderful. There are many programs and also outreaches to really access the vulnerable populations and ensure they have access to the information and also resources related to cervical cancer prevention. Well, that's great, but I would like to know what hurdles or challenges has the board pinpointed in spreading awareness about cervical cancer, and how is the organization working to overcome these challenges, Doctor?
Yeah. So as what we have shared, there's a lot of initiatives, free testing that has been provided for the population. But definitely, first and foremost, is the awareness and information that need to be spread more to our women and community out there, because the awareness is still, and education-wise on cervical cancer is still quite low in Malaysia, where we need to push upon, so that with increase in awareness and knowing importance of this screening, that will also have to save their lives, and early detection of cervical cancer would make them to come earlier, and seek intervention early. So apart from the awareness alone, of course, a lot of myth or misconception in terms of women mentioning that this is painful, pap smear is painful, and there's a long complication that comes with it, but that is only myth, as it is what I've shared earlier. And with the new HPV DNA testing, it is more easier to be done, and it is really painless. You don't have to put in speculum, where like what we used to do in pap smear screening, pap smear procedure. It's just as simple as a normal swab, right? And put in with a few seconds and take it out. It's very easy, and anyone can do it at their own pace. And other than that, most the other component that hinders them to come, of course, the accessibility and the logistic wise. When you talk about the rural area, right? It's also quite difficult for them to come. That's where we will, in National Population Family Development Board, we will go down. We will go to the rural area and outskirt area, and bring our Pusat Keluarga Bergerak, our mobile clinics, for them to do it during these outreach programs.
Fantastic program you have there. Definitely you need to continue to reach out to the vulnerable communities, especially in the outskirts. So thank you so much for championing this project as well, Doctor. Hopefully more women will be aware of cervical cancer and get themselves screened. So thank you for your time today, Dr. 𝘊𝘌𝘕𝘊𝘌𝘙.
Thank you so much.
We'll take a short